Good morning, everybody. It is 11 o'clock Wednesday morning, Eastern Time. My name is Dan Deller, and I'm the Principal Consultant with Progressive Safety Management. And while we still have some people logging in and kicking off, we have a lot to get through this morning. So I'll just start off while people are still logging in, doing some general background and some housekeeping. Today's webinar is being recorded, as with all of our webinars. It will be on demand, so you will be able to rewatch it, or even share the link to others that you think may benefit from today's webinar, and they can register and watch it at their own leisure. Fast forward, rewind, stop, pause, all that good stuff. So that's the good news there. It is being recorded, so we'll be able to share that, and you can watch it later on, especially if you need to run. And we do understand that life and business does continue on, but we hope you do get to stay and stick through with us today. It should be as interactive as a webinar can be. But the other is that there is a spot for everybody to be able to submit questions. So as we go through, I'd like to hold off. We have a lot of information to cover, so I'd like to hold off to the end to answer those questions. However, as they come to mind, type them in. They go into a little hold area, and I'll review all of those and answer them. And if I can't answer them by the end of the webinar today, I will make sure that I sit down and answer each and every question, and I get that back out to everybody. The others is a chat feature. So if we can't figure out the Q&A, or you got an issue, you want to raise your hand, ask, you can't hear me, some technical difficulties, feel free to use the chat feature. And I'll try to keep my eye on those as we move through this. All right. But again, as I mentioned, my name is Dan Deller, and I'm with Progressive Safety. I'm a certified safety professional, and I've been in the safety business for 22 years now, and worked in a lot of different industries, and been consulting now for over 15. So without any further ado, I'll tell you a little bit more about us. We are a safety management and loss control safety company. We are based here in Charlotte. However, we have offices from the Mid-Atlantic and down into the Southeast, with consultants spread out. We work in a lot of different industries: construction, manufacturing, utilities, oil, gas, all that stuff, with a whole bunch of different expertise that we're able to bring to our partner clients. It's just a little bit more. Of course, we're providing safety audits and inspections, safety training, on-site safety supervisors, written safety programs, and the list, of course, goes on. If it's safety, we do it. Okay. Here's a little bit snapshot of our Carolinas team. At least there's 14 others of us that do cover the Mid-Atlantic and Southeast, but I will say that the major concentration is here in the Carolinas. Of course, as we were founded and established, we started the growth here first. But here's a little snapshot of our Carolinas team. We do appreciate them, everything they do, as well as the other 14 that are out there supporting us. And I don't want to go into all about us, just want to give you a general background, so you do kind of understand a little bit more of who we are and where this information and how we put this stuff together, and the expertise that was involved to be able to share this with you today. But our mission right now and always is to help protect businesses and their employees. Okay, especially during this COVID-19. If there's anything that we can do to help share information, provide help and support and resources, that's what we're here to do, to help protect the businesses and the businesses' employees. Okay, so that's what we're going to focus on. This presentation, this is not where we're going to sit up here at the top and say, hey, based on all of this, textbook, many years of experience of dealing with pandemics and situations that we're all going through, it doesn't really exist. So, we're going based off of best in what we're learning and figuring out, sharing information and resources of, what has worked in the past based off of other pandemics that have happened, and control of health issues. But something of this magnitude, obviously, is continuously changing. So we need to be able to continuously change, evolve, and stay flexible. So this presentation is really based on sharing lessons learned and best practices from our viewpoint, because we work with over now 450 client partner companies. So we have a very big vantage point of what others are doing and what's going on out there and how they're overcoming it. And so we just wanted to be able to help pull that together and share some resources and share that with you today. So let's jump into it. We're 5 minutes in, and looks like we've got a full, quite a full house, but about everybody who registered almost is logged in. But I think we've got a pretty good group here. We'll move into the objectives. So here's what we're looking to gain out of today is an understanding of what is COVID-19. And hopefully at this point, we already all know what COVID-19 is, but I will touch on it because we do need to start off. So I'll hit on it quickly and we'll move forward. The other is how COVID-19 affects workplaces and employees, ways to prevent COVID-19 spread, risk to your businesses, to your business, and the current best practices to reduce your risk and the liabilities, provide you tools and resources. And at the end, we're going to talk about some little takeaways to wrap up and leave you with some stuff to take away from here that you can go exercise and utilize in your own workplace, assess yourself and improve, and make sure that you have everything you need and your business is protected and your employees are protected. All right. So what is COVID-19? I don't want to get too textbooky here or anything. So here's just a general overview. Everybody should already know what this is, but COVID-19 is a respiratory illness that is spread from person to person, very similar to the flu, and shares many of the same symptoms. So what are those signs and symptoms? First is fever, cough, and shortness of breath. Those are the three main signs and symptoms of COVID-19. There are others that we could list here, but those are the three core signs and symptoms that we need to stay focused on. All right. Any other kinds of signs and symptoms could be easily confused. And that's why it's just really essential. If you're not feeling well, or someone else that is on your team that you work with is not feeling well, they should stay home. And it's important that they get checked out by a medical professional. Okay. So we can determine if it is or if it's not. So throughout our webinars, for those of you who are regular attendees of our monthly webinars, we always try to make it interactive. We include quizzes, polls, that kind of stuff to encourage engagement. So here's our first one here. COVID-19 is a respiratory illness that is spread from person to person, very similar to the flu. True or false? I always like to give the first one a little bit of a time here to kind of wake everybody up. All right. Well, looks like we got a pretty good response here, letting it roll just a few seconds longer. But of course, the answer is true. These first few ones they're going to be very obvious. They are the most important key points. I do just want to reiterate and make clear. Our next poll question is COVID-19 signs and symptoms are, and you just go ahead and check all of the ones that do apply: fever, cough, shortness of breath, or none of these. Excellent. And everybody, of course, got that correct. The answers are fever, cough, and shortness of breath. So we are going to use this as a roadmap to make sure that we do know where we're at in the webinar, and so you guys can stay on task and know what we did cover and what to expect coming up next. So so far we covered what is COVID-19. We covered the signs and symptoms. Upcoming, what we're about to discuss is how to protect yourself and others. So how COVID-19 affects employees in the workplace. The first we're going to talk about is the employees. And that's obviously their health and safety. Okay. If they get it, contract COVID-19 or it spreads to them, of course, it's going to be their health and safety is at greatest risk. The ability to report and come to work. We have employees out there who are caretakers, have other family members, or maybe they're at a high risk. Okay, and they need to care for others or stay at home and take care of them, or maybe they're high risk and they need to be even more careful to make sure that they don't contract COVID-19, and so they might be affected by not being able to come to work. The next is fear, concern, breakdowns, and confidence and trust. Okay, so this is kind of the elephant in the room. One I do want to point out. I'm not going to hit on it hard, but it will come up a few more times. So I'm just going to go ahead and touch on it now. Is that, the elephant in the room is that employees right now, I mean, there's a lot of uncertainty. They've never dealt with this. They don't know what's going on. They're concerned about their families, their friends. They're concerned for their own personal health and safety. And so there could be fear out there. They could be very concerned. All those items can lead to to a breakdown in confidence, where maybe they're just not confident anymore in either themselves or the confident of being able to be protected by potentially going to work. Okay, which could ruin and break down trust. Okay, and so as we discuss and go through how we're going to protect and manage our risk, is that we really need to focus on making sure we have good plans and that we're communicating. The better plans that we have and the more that we communicate our plans, the better we'll be able to address the elephant in the room, which is the fears, the concerns, and any level of confidence that they have lost in themselves or by going to work. If they don't feel that anything's being done or nothing is safe at work, they're going to be scared to come to work. They're going to not have confidence anymore, let alone confidence in themselves to do their job safely and be healthy while they do it. So just so you do know, those are some of the ways that employees are being affected, is they do have these fears, concerns, and they could lower their level of confidence in themselves or at work. So how's it affecting businesses in the workplace? The obvious big one is that it may stop all or at least portions of business operations. The other is it may slow down your supply chain and your production. Could affect quality. It may affect safety and health of the employees. And, what we need to be talking about and what we're talking about right now is COVID-19, coronavirus, right? Well, the other thing we can't take our eye off of is general employee safety and health. Still doing high risk activities, doing high risk jobs, and they still need to be focused on the task at hand. And they may be, overwhelmed, thinking about those at home, thinking about these new protections and these new procedures, and the worries and concern of contracting COVID-19, that they're so focused on that they're not paying attention to what's at hand. So I do also want to make sure that everyone is staying focused also on the other safety aspects of the risks that the employees are being faced at their work, and it's not all COVID-19. Okay, should we be discussing a lot of it and covering it regularly? Absolutely. It's new. There's a lot more strict requirements that are being put in place, and they should be discussed frequently because it's also changing frequently. Okay, but at the same time, we do need to focus on still regular, everyday, high risk, normal risk, safety for employees. So what are the ways to prevent the spread of COVID-19? You can protect yourself and others from contracting and spreading COVID-19 through social distancing. Okay, we've heard a lot about that. That means stay at home or work from home if you can. Stay at least 6 feet from others. Wash your hands frequently and avoid touching your eyes, your face, and your mouth. Okay. So this is hopefully nothing new to anybody on the webinar, and we should be doing this as much as we can. So here comes up a question here. You can protect yourself and others from contracting and spreading COVID-19. That is true or false? Excellent. And of course, that's true. Which of the following are ways to protect yourself and others? Excellent. Everybody got that right. Stay 6 feet apart. Wash your hands frequently. If you feel sick or have signs and symptoms, stay home. So we're back here to a roadmap. And so far we've discussed what is COVID-19, the signs and symptoms, how to protect yourself and others. And up next, we're going to discuss the risk to your business. Okay, so those first 3 check marks, those were very general background. Those are things that we should have already known. So I did kind of move through those a little bit quickly. As we move into these next ones, this is the stuff that we're really here to talk about. Okay, so we're going to cover up next is risk to your business, as I mentioned, and what your business needs to do. So we've already discussed a lot of the background, and we talked about social distancing, and we talked about staying at home and working from home, and we hear you. You say, that's nice, Dan, but what if we can't social distance? What if we are an essential business and we must continue to operate? What if we need to be closer than 6 feet from others? What are the risks to my employees? What are the risks to my business? How do I protect my employees in my business? What are other companies doing? What are the best practices? What do I need to do to protect my employees and my business? All right, we are listening, and these are the questions that have been coming. And this was at the high request from everybody to say, hey, we'd love more information about this. Let's see if we can't get a webinar going. And so by by your guys' request, and we put this together. And these are those questions that we've been hearing and that we're going to be focused on and addressing. So, yep, we hear you. We have to go to work. We can't social distance always. We can't work from home, not always. We are essential business. We need to work with this current hazard. What do we do and how do we do it? So few other questions we do want to pose is, what if an employee contracts or worst case spreads COVID-19 to other employees? If you haven't thought about this question, you need to start thinking about it now, and you need to start thinking about making plans. Okay, I know right now we're always focused on, gosh, what do we need to be doing now? We need to protect ourselves. We need to protect, but we do want to also make sure that we do think about the next step. What if an employee does contract and worst case spreads the COVID-19 to other employees? All right, the obvious one is employee health and lives. Okay, so that's the what if. That's what's going to happen. All right, so we need to put plans and measures in place to make sure that we can protect that from occurring. So what are the risks to your businesses? The first one is OSHA complaints and investigations. All right, we have seen and heard and been involved with a lot of uptick in this area. So that's that elephant in the room that I mentioned early on with the employees' concerns. Those aren't just employee concerns. Those also could be those also could be your customers, your clients. It could be your vendors, your contractors, as well as your employees who may feel that the current protections and precautions aren't being put in place, and health and safety is at risk, and people are picking up the phone in high volumes and calling OSHA's 800 number to make employee complaints against other companies. Okay, saying companies aren't shutting down and they're non-essential. Companies that employees are calling and saying, "Hey, I go to work and they aren't doing anything. There's no hand washing stuff. We're working too closely. We haven't gotten any training. We don't have any protections." And that's that fear. That's that lack of confidence. So being able to help get rid of the elephant in the room is going to help and reduce these OSHA complaints and investigations. When OSHA does receive that complaint, they do have to follow up with an investigation, whether it's true or not. They have the obligation and they must follow up and do an investigation. So we are seeing a large spike in that right now. If in fact you aren't doing anything, a business isn't doing anything, or somebody does contract COVID-19 or if there's a spread, there's a potential for OSHA citations as well. There's a lot of unknown in this area. However, OSHA has come out to say that COVID-19 is not going to meet the exception for record keeping requirements, that it's just a common cold and flu. They're looking at this as they're equivalenting it to a disease such as tuberculosis, and that it will be it will be able to be recordable, and organizations and businesses will be able to be held accountable in the area of providing a health and safe workplace. Okay, so citations are definitely a real risk. OSHA recordables. Okay, so if you have employees, an employee or multiple employees who end up hospitalized, or worst case, become a fatality, they can become OSHA recordables and be on your OSHA logs. And for those are important to, especially in the construction business, those can have great effects. If somebody does end up hospitalized overnight, or worst case, again, fatality, you'll need to call OSHA and report that if it was work-related, of course. But again, these are risks. The other is workers' compensation claims, going down that same road of saying, well, if it's work-related and if they weren't at work and didn't get exposed to the COVID virus itself, there's a potential that these medical bills and worst case fatality, that these can become workers' comps claims, okay, as well as general liability, other contractors or vendors or customers or the public claiming that that your services or business or work or products delivered and spread it. The likelihood, we're not sure, but this is a major topic right now and a big risk, and we want to focus on being risk averse, so we should plan and prepare to not find ourselves in that situation. And if we do find ourselves in that situation, we want to make sure we have proper protections. So we're going to roll into being able to come up with the best preparedness plans as well as response plans in ways that you're going to be able to demonstrate and document and protect yourself in case one of these risk liabilities do occur. So now that we've talked a little bit about what some of the actual risks to your businesses are, let's put this a little bit more in perspective. This occupational risk pyramid for COVID-19, this comes directly from OSHA. Okay, so they produced this and they classified businesses to help give businesses a better understanding of where they fall at in the area of risk to contracting and or spreading COVID-19. So at the very top here, we have high risk. Okay, those are going to be your doctors. Those are going to be your nurses who are actually treating COVID-19 patients. Okay, the next which is high is going to be, those who are still maybe in the front lines, who may be processing and checking them in, or having them in their work areas. They're going to find themselves in high. Where we're, those on this call who are most likely going to find themselves is in the medium, and the majority will find themselves in the low risk to caution category. So what's the definition of medium? It is medium exposure risk jobs. Those include those that require frequent and or close contact, so that's within 6 feet of people who may be infected with COVID-19, but who are not known or suspected COVID-19 patients. Okay, so again, not a large population of everybody on today's webinar, but definitely may be a potential to find yourself in the medium risk category. But for the majority, everybody's going to find themselves in the lower risk exposure group, which are jobs that do not require contact with people known to be or suspected of being infected with COVID-19, nor frequent close contact. So as long as we can keep that 6 feet with the general public, workers in this category have minimal occupational contact with the public and other coworkers. Okay, so most of us find us in those low risk exposure. Okay, so if this is new to you, this is definitely probably going to be new to your employees. This will help with the elephant in the room, helping them to also understand that, hey, we might be an essential business, but let's be realistic. Where do we fall at, and what is our level of risk to exposure of this? Being able to communicate that to your employees will be able to go a long way in being able to help make them feel more confident in their coming to work every day, more confident in them doing their job tasks, and not and remove that fear or concern of being exposed or contracting COVID-19. So if we're in the lower exposure risk categories or even medium, there's a lot of things that we could do to push that even to a lower level and help protect ourselves. So let's talk about what businesses need to do to manage risk. First and foremost, develop a written preparedness and response plan. Okay, that's a 2-part piece. Preparedness talks, it's focused on proactive. What are we going to do today to make sure and to help not expose anybody to the virus, and that what are we going to do to prevent somebody from contracting it or spreading the virus? Okay, the second piece is the response plan. What if somebody does? What if somebody comes into work and all of a sudden develops signs and symptoms? What if they were at work yesterday and today they get test results that say they were positive for COVID-19? And what if, right? It's the response plan. How are you going to isolate them? How are you going to minimize that exposure? What are you going to do with the employees? How are you going to clean your site? When are you going to let them come back to work if you send them home? Those kind of things, right? So I just want to point out that these plans are 2-piece: preparedness and the response plan. So we should develop a written plan for that, all right? The next is identify all groups at risk. And this is an important one that maybe you haven't thought about. The first one that comes to mind when we say, well, we need to identify all the risks to our employees. And we kind of stop right there. We go, well, but there's more at risk here. There's other groups. Do you have customers coming in? Do customers or vendors or contractors interact with your business? How close is your business to the public? Do they interact with the public? Are they close to the public? Does the public interact with you? What are the groups that potentially can expose or interact with your organization that could pose a risk? We recommend that you group each of those groups, write it down, put them in buckets, and then you might need to go into subgroups like employees. You might have employees who just work in the warehouse. You might have employees who work, in customer service. Well, what does that mean? Is there actually a showroom? Is there a parts room? So on and so forth. So you might need to break down some groups into subgroups, but the first step is identifying groups. Once you identify the groups, The next is you need to identify the sources of exposure for each of all of those groups. Okay. So if you're in the warehouse, what are all the sources that you could potentially be exposed to it, to getting it or spreading it? Well, if you're in the parts, the showroom, of course, they're going to have different exposures to the source. All right, for getting it as well as spreading it. It's a two-way, in and out, right? So identify all those different sources. Once you've done those two things, we can now look at our controls. Okay, so identify the groups, identify the sources for the groups, then determine the controls for all the groups and all the sources. Okay, so it's then saying what are we going to do? How are we going to control and prevent any sort of exposure or spread of the virus? Once we've done that, we're going to need to communicate our plans, and we don't want to just communicate our plans to our employees. I want to again go back to all the groups, okay? Because if we're interacting with the public or other contractors or vendors or customers or clients, they're also got the elephant in the room. Like, man, do I really want to let my contractor or my service provider or my company come into our business or interact with our business or our customers or our clients or the public? And so, communicating with them frequently to tell them what it is that you're doing to help protect your own employees as well as protect them. That's that two-way street, right? In and out. We need to make sure that we've got protections and controls in place to not allow anything in and not let anything out. They will be much more likely to feel, again, confident in your ability to interact with them. If it's a customer, client, or contractor, or a vendor, or service provider, they'll say, okay, hey, that's great, come on into our house and do whatever. If we're not communicating, they may have fears and it may affect your business. It may slow down supply chains. It might affect being able to go provide service and deliverables, so on and so forth. So again, communicate, and do it to all groups. Each group's probably going to get a different message, of course. I do just want to say that. What you tell your employees is probably not what you're going to tell your customers, and so on and so forth. The next is we need to then train employees on the plans, because we can have the best preparedness plans and control plans, but if they don't know how to go and implement and use and exercise these plans you guys have never done before, it's never going to get done. The same thing with response plans. If you don't train your employees on how to respond in case somebody's reporting ill or, saying they don't feel well or whatever, if the employees don't know what to do and how to do it, you're not going to be able to control a potential spread or outbreak of this virus. So again, train your employees. Next is going to be implement the plans. That's the obvious one. We then need to go do what we said we're going to do. Once we've implemented our plans, go and conduct an internal audit. Go check to see if your plans are all in place and if they're working as you thought they would work. Are they actually working? Do they make sense? Are people actually going to be protected by doing what we thought would work on paper? Next is going to be, also do recommend conduct a third-party audit. Okay, this is giving that outset set of eyes of things that maybe you haven't thought about, considered. The other thing it does is it helps have a bias, objective verification of all of the things that you've done, saying you do have plans and they are in place, and an unbiased, objective party has verified that things are in place and they are effective. Once you do both of those, is develop action plans for improvement. So as we learn from, hey, maybe we didn't think of everything and we're missing some other aspects or opportunities, let's develop action plans and then go implement those action plans to make sure we're improving our preparedness and response plans. The last thing I do want to mention is how we're going to protect and manage our risk is we need to document. Again, I want to go back to the liabilities. If, worst case, one of those liabilities, you have to deal with it and you need to defend yourself, you're only going to be able to do that by documentation. So document all of these things that you're doing. It's going to help create your case and position to say, you know, as an employer, our responsibility is to provide a health and safe workplace, and we did, and we have, and we continue to, and this is how we do it. Here's our plans. You know, we've communicated it, we've trained, we've implemented, and we've looked internally to see if it's working. We've verified it's working. We've even had others come in and assess and to test to see if things are working as well, working the way they should. And here's all of our documentation. Okay, it was definitely going to help move you through being able to protect yourself against any of those liabilities that may come up. All right, so I know that was a lot of information. We're getting into the good stuff. So I want to take a little break and do another little self-quiz survey here. So check all that apply. The potential risks to your business include very good. OSHA citations, general liability claims, workers' compensation claims, and human health and lives are at risk. Oh, the next one is OSHA classifies lower exposure risk jobs are those that do not require contact with people known to be or suspected of being infected with COVID-19, nor frequent close contact with the general public. True or false? Very good, and that is true. Does your company have a written COVID-19 preparedness and response plan? All right, and if you don't, you should go out and complete and develop one. Right now, you know, you if you were part of an employers association or a business association, a lot of them like AGC, ABC, Employers Association, a lot of them are pulling resources and sharing this information. You do simple Google search. You can also obviously contact us. We will work with you to develop your preparedness and response plans. But if you don't, put something together. It's fairly easy to do. You'll have this presentation with the checklists, and if you just go through the simple, hey, who are my groups? What are the sources? What are control plans? You know, answer the questions of what if. It'll all take care of all of those things, and it will serve the purpose of a preparedness and response plan. Okay. So back to our roadmap here, we've discussed what is COVID-19. We've discussed the signs and symptoms, how to protect yourself and others, risk to your business, what your business needs to do. And up next, we're going to discuss best practices and for exposure control. Okay. So all this next information, this is what others, you know, are currently doing, things that we've seen out there that have been really innovative and those kind of things. And this will be the sharing of the best practices. Before we dive into it, I do want to introduce to you, if you're not familiar with it, the hierarchy of controls. This is a safety term, a risk type term that is how we should always approach any sort of corrective action or plan that we do when we're faced with a hazard, not just COVID-19, with anything. We always want to start with the most effective, okay? But I do want to say that the most effective may not be the most economical or the cheapest, okay? So the most effective is starting in the hierarchy of controls, is there at the top, and working our way down to the bottom, which is the least effective. So the most effective, we first look at elimination. Can we physically remove the hazard? Okay, if we can't do that, then we want to look to see if we can substitute it. Can we replace the hazard? Okay, this could be something like working with outside of COVID-19, it could be working with a really bad chemical and swapping it with a chemical that's not as hazardous. Those kind of things. Could you substitute something? Engineering controls is going to be next. We want to isolate people from the hazard. And if we can't do that, we want to look at doing administrative controls, so change the way that people work. And then last and least effective, in our last resort, we should be looking at protecting workers with PPE, personal protective equipment, okay? So I've broken down the exposure controls of these best practices in the buckets of the hierarchy of controls, okay? So the first one is elimination, all right? So we should, when we look at all of our groups and we look at all the different sources, we should look at what kind of controls can we implement. And the first one we should look at is our elimination. And the only options, the most common options here for elimination is going to be isolation and work from home, okay? So just to isolate any work practices away from where any of that potential exposure could be. That's going to be your best case scenario. But as we mentioned, we understand that business must continue. We have essential businesses and we do need to operate, and we cannot all isolate at all times. So we need to look at other hierarchy controls. Substitution, that's replacing the hazard, and the hazard is COVID-19. We're not going to be able to replace that. All right, engineering controls. These are for probably our higher risk, going to be our most expensive controls. So our higher risk businesses, we see this a lot in the healthcare industry, where they have ventilation. So they're adding, if you're hearing on the news, they're adding the negative pressure to all of the rooms, which means they need to keep doors closed. And basically they're sucking out all that bad air through filters and out of the building. So it's not being recirculated into other rooms and into general open work areas. So, if you are, a business, which we do have many partner clients who, have positive pressure in some of their manufacturing facilities and production floors, that, maybe you look at continuing to utilize that, or isolate work areas and close doors, and maybe bump up those ventilation rates or those kind of things. Physical barriers. This was some of only the best examples I was able to find out there that actually had photos, is we're seeing it in the grocery stores. And if you have work areas and workspaces, especially for those that have employees who work at a workstation, they may be able to put up physical barriers, okay? The other are going to be administrative controls. So we've now left the engineering controls and moved down into some administrative controls. The first is, I'm going to mention social distancing at work. Okay. We've seen a lot of organizations, just being able to help create some of those buffer zones by, putting in tape on the floor, or increasing the size of work areas. So maybe they're not as working as close together. And then marking off those work areas and painting them or taping them also just helps remind everybody to stay aware and in those work zones. Some other administrative controls is traffic management. This was a great one. That especially when we have office areas or trailers at the construction sites, or when we do tight work areas, is to create a traffic management plan, and it doesn't need to be as formal or scary as I just said it. It could be something as simple as painting the floors and that photo with paint that creates one-way traffic. So that way you don't have people who, are trying to pass by each other in the hallway. Um, if you have two doors, have one door for going in and one door for going out. And at each door before, you go in, they're able to wipe down their hands or sanitize or wash their hands. And then, so when they, are able to do that before, enter, maybe after, whatever the case might be, but also that there's a flow of traffic of it's always a one way in and a one way out type of a flow. So you're not having people running into each other. Same with just the regular work areas. If you are able to create better pedestrian ways, that way we, don't have people running into each other or those kind of things. Some other that we've seen the innovation, especially in the construction industry, some really great ideas and suggestions and ways that they're creating hand washing stations and sanitizing hand stations. We've even seen some like water coolers that have been rigged up that for washing hands, like off of the back of trucks, where there's a lever replaced on where the spigot's at, and a rope and like a foot pedal now. So now you can walk up, push with your foot, and the water flows out, so no one's touching the water cooler to be able to wash their hands. And then, of course, I'm calling it a water cooler, so they have done the proper writing and marking it permanently, saying that this is non-potable water, do not drink, used for hand washing, that kind of stuff. So some really good practices, again, to focus on what are the sources, what's the potential, and what are the ways that they could potentially contract or spread the virus, and saying, okay, that's an exposure. What are some options and some controls that I can limit my distance or limit contact or separate people, those kind of things. That's how they came up with those innovative ideas. Some other staggering work shifts that we're seeing with a lot of our client partners is that, we have some who have a lot of shift changes, and those shift changes typically overlap. So they're able to communicate and say, hey, I was on the first shift and the second shift has got to come in, and they need to talk and discuss. Well, you know what? Maybe they need to write it down on a daily log this now. And we need to, that first shift needs to leave a half an hour earlier than the second shift comes in. So then that way the first shift and the second shift aren't passing by each other. They're not in the same space. It's not overcrowded. Or we've seen some who've ended one shift 30 minutes earlier and started the second shift 30 minutes later, allowing a gap of time to be able to go in and clean. Okay, so look at altering shift changes, look at altering work schedules, and reducing operations to only critical and essential operations and employees, and restaggering, construction schedules, production schedules, and work areas. Some other administrative controls that we are seeing, and this is as we kind of progress, and this is constantly evolving, is heightened controls. Okay, so we're talking about now screening employees and screening anybody interacting with our business. Okay, so which can also create its own risks to potential sources and spread of the sources. Okay, so I'm talking about checking and screening people for temperatures and signs and symptoms. Okay, so there's been a lot of talk right now about, do we start testing and checking temperatures of our employees or anyone who interacts with our business? And same thing with, of course, the whole respirators and nose and mouth masks that maybe are homemade. Those things, should we do them? Should we not do them? Each of those you're going to need to be looked at in their own level of risk, because the risk is it being administered correctly, properly, that doesn't add additional exposures to spread, if that makes sense. So what we have for those that have done some checking and monitoring and screening, we've seen one way is employee self-checking. Maybe create a checklist, a simple checklist that says, hey, employees, either make it voluntary, or you could make it required and say, hey, every day before you come in, answer these few questions. How you feeling healthy wise on a scale of 1 to 10? 10 being I feel fantastic, and 1 feeling, I feel the most sick I've ever felt before in my life. And they can score themselves maybe daily. And same thing with and that checklist, maybe it says, how does your body feel? Do you have any body aches? Do you have a cough? Do you have a scratch in your throat? Do you feel warm? What is your temperature? Okay. But I will say there will be variations on that. And it won't be perfect, because what a person self-reports or how a person feels compared to another person on their self-reporting can vary, and it can vary greatly. Some people can handle a high tolerance of pain while others can't. So same with if they are taking their own temperature. If they take their own temperature, how are they doing it? Are they doing it correctly? Did they do it long enough? What they're using to take their temperature, was it the right tool? Is it calibrated? How old is it? Is it broken? Is it working at all? Those kind of things. Okay, so there's some variables in there, but potentially I think it's something you may be able to take a look at and consider. The other is employer screening. This is another topic where there's been some concern on there, is that if an employer's screening and says, green light, thumbs up, come on in, are they accepting the level of responsibility and liability of saying, hey, all the employees who moved beyond this checkpoint are good, and they don't have it, or aren't able to spread it. So and then if they do check temperatures, how do they control the contaminated tools that they use to determine, check the temperature? Because unless you have a non-touch thermometer, odds are you're probably looking at real thermometers that someone's going to put in their mouth or put on their skin. So, and then how do you dispose of that? How do you control that? Do you have one person who handles it, or do they handle it themselves? Well, if they handle it themselves, it's a big control issue and concern. There are employers going down this road and increasing numbers. There are certain states and areas that are requiring some of these for some of their agencies. So we're seeing this being a greater topic of conversation, and is definitely an option, but it just needs to be planned and executed correctly. And this is something that you could add to your resource of control. Okay, so if you are interested in talking about it more and diving into this beyond this, feel free to reach out. We can share more resources on it and or help put together some screening processes and protocols in place. I did have a question come in saying, is screening employees for temperature legal if done properly? Yes, it is. And what I would recommend, again, if you go down that road of doing it, it's going to go back to the whole communication side, right? Is saying that we aren't, that this is a proactive measure to help put in a level of protection and precautions. We are not testing people for COVID-19 to see if they're positive or negative. We are not determining if someone is or isn't. All we're able to do is identify if there are any other higher or greater potential risks to contact and spread, if that makes any sense. It's kind of like saying, hey, if you don't feel well, don't come to work. you know, it's obviously a little bit more hands-on, but it's kind of that piece. It's not saying that, well, if you didn't come to work, that means you have COVID-19, and we're saying you do. It's kind of, that's the message I guess I'm trying to say, is that it's that message. It's we're not saying you have it. We're not saying you do or you don't. We're just saying that based on you know, an abnormal temperature above X over a course of period of time, or whatever protocols and requirements we put in there, is basically that we aren't in the workplace. We're not going to accept that level of, you know, risk and this and that. Now, the whole other legal side on the HR side of then what do you do and how do you manage when you send the employee home? Because let's say they test it, you know, let's say you make a requirement of anything over 99.5, 99.5 or something like that, that you can't come to work. Then what? You know, sorry, you go home. Are you going to pay them? Yeah, that's a whole nother separate issue, but I just want to throw it out there. And that's why I say these things need to be very well thought out. Okay. So, so I got some more questions coming in. That was one just right on topic. And I know there's some other ones, but they're starting to fly in now. So I will try to come back to these here in just a bit so we can touch on some other stuff, because we're coming up on an hour. All right, so here's some other administrative controls. Is create an information hotline if you haven't, okay? Because worst case is an employee doesn't know what to do, forgot, or is confused, and they come in and they ask, or they don't ask at all, or there's an exposure. They're saying, hey, I'm not feeling well, but I'm not really sure if he said come in or not, or go see so-and-so, and now you have a whole other problem of trying to control the response. Okay, so creating an information hotline and ways for employees to get in touch with you without having to, you know, be face-to-face, this and that, to get information, to share information, to ask questions or express any concerns is going to be extremely helpful, right? That's going to help address the elephant in the room with the whole, you know, fear, concerns, lack of confidence stuff. Okay, so if you haven't looked at setting up an information hotline, do so. Maybe it's a spot on your website, or maybe it's a phone number they could call. Whatever the case is, take a look at doing that. The last, are there more administrative controls? Yes, we could probably go on, and I'd love if you have other great ones that maybe I didn't touch on or I didn't think of, please share those. If you do share them, I'll compile them and I'll get them out to the entire audience so they could see those. The next level of protection is going to be personal protective equipment, and we should be looking at this as our last resort. Okay, those are things like respirators, masks, gloves, goggles, gowns, coveralls. Okay, and I would look at those as when we get into that whole question and situation of we cannot maintain 6 feet separation. You know, it's a buddy lift. I need to get this piece of equipment or material in there. Let's minimize how often we do that to you know, minimize that as much as we can. But then secondly, if we do need to do it, let's do it in a controlled environment. Let's do it in a good environment, and let's make sure that we do protect ourselves. Okay. So we, you know, and then have a way to have hygiene afterwards, or decontaminate, or whatever you want to call it, you know, where you can wash your hands and change your coveralls or get rid of your gowns or whatever the case might be. But the point is, we should be looking at personal protective equipment as our last resort. Okay. So it doesn't mean, oh, it's our first resort and we're going to have all employees put respirators on. Nope. Again, there shouldn't be a need to have respirators if we're maintaining the 6 feet apart. If we do need to get closer, then do that. From a requirement standpoint is what I want to say. You know, again, speaking on protecting the employers and the employer's risk. And so respirators is being, you know, making things required versus voluntary are two separate things and carry two totally different liabilities. And so I want to focus on the required portion. And so if we do need to break that 6 feet, maybe then we make things required, but if not, things are voluntary. Okay. But again, our last resort should be PPE. So here are some other best practices for exposure controls. As for those of you who really know progressive safety, we are big proponents of employee engagement. Okay, get the employees involved in all of this. Anything an organization does in the area of safety and loss control is way more effective if it comes from employees and not from the management. Somebody sitting in an office, sitting around a table saying, hey, I came up with this great idea and this is what we're going to do and how we're going to go do it. Now everybody go do it. And you're not even the person doing it, or the group of people making those decisions aren't even the people doing it, so get them involved. One, they do it every single day. They probably see things that maybe us sitting in an office or who don't do it every day. They have much better perspective. They actually probably see where the sources are or where the exposure and the hazards are. And even better, they probably have really great ideas of ways to put in place for protections. Okay. And if they come up with the ideas, and if you guys can do them, I mean, if they make sense and you can afford to do it and it doesn't affect, the rest of your business, and you're like, yeah, let's do it. They're going to be much more likely to actually go and do it. It was their idea, right? So consider putting together focus groups. All right. If not, maybe just solicit input, ask them questions. Hey, you got ideas of what we could do, how we can overcome this? So I just say, do get employees involved. The next, also what we've seen out there, which is kind of neat, is a personal COVID-19 safety pledge or a safety plan, right? Is to say, hey, you know what, as a company, yeah, we came up and we have these protocols and this is what we're going to do and how we're going to do it. But, encourage people to do their own plan, to say, hey, here's what I'm going to do personally to help protect myself and protect others. These are the things I'm going to do. I'm going to wash my hands every so often. I'm going to, and have them just write it down, and maybe, it's a cool little piece of paper. We've seen them post it up on their work areas or, out front of their office, because it could also tell the other groups of people who may be interacting with them what they're doing and what they expect. So they know how to interact with them. So before they come barging into their area, they go, oh, hey, they're going to, maintain, of course, 6 feet of distance, or that they're going to wash their hands before and after. So maybe that they're going to do it as well. My point is, it could help in really just raising the heightenedness of their own personal commitment to being a part of the solution. Self-monitoring and reporting, we talked about that. Consider taking a look at building a checklist for employees to kind of self-assess themselves. Consider employer monitoring, periodic temperature screenings, those kind of things. So real quick, we're kind of coming into the end here. We've talked a lot about the best practices for prevention and protection. I want to talk about the response plan. Okay. So what I've just done here for best practices is I've left you with a set of questions and a checklist to kind of answer. And if you answer these things, and of course, there's going to be more questions you could ask, but I want to keep it simple. Our motto is safety management made simple. So, but do ask yourself, if you really haven't asked yourself, what if somebody develops signs and symptoms? Worst case, what if they test positive for COVID-19? What if they're at work when they develop the signs and symptoms? What are you going to do? How are we going to do this? How will you respond? Do you have an isolation plan? Do you have a plan to minimize exposure to others? Do you have a notification plan and call tree? Do you know who and which agencies need to be notified? How will you clean up the site? What will you do with the other workers? If they go home and you send everybody home, how and when will they get to come back to work? How will you communicate with them? All those things. Okay. Your COVID-19 response section of the plan should answer each of those questions at a minimum. Like I said, there could be many more questions we could keep asking ourselves, but from a simplistic standpoint, if you don't have a plan yet, you can almost just sit down and answer those questions and write it down, and now you've gotten a written plan. If you haven't thought about those questions, it's time to think about them now. Come up with plans. Make sure you communicate those plans. Make sure you train your employees on those plans, and that you're ready to be able to execute those. Hopefully never, but if you do, you'll be able to protect yourself, and you'll reduce your liability to all this stuff. So we got some more questions here. Hopefully this will wake you back up if I've lost you. Engineering and administrative controls should be used before using PPE controls. True or false? Very good. And so, yes, the answer is true. We should be using engineering and administrative controls before we use PPE controls. Can they be used simultaneously, and should they be used together? Absolutely. I mean, we shouldn't say, oh, well, if we're going to do PPE, let's not do administrative, or if we're going to do administrative, let's not do engineering or PPE. We should use them all in conjunction. But while we're going through developing our control plans, we should always first start with engineering. If we can engineer out the hazard, the COVID-19 hazard, then we don't even need PPE because we engineered it out. It doesn't exist anymore. If we're all working inside of a plastic, in a bubble or in a box, we wouldn't need a respirator or gloves, those kind of things, but we can't always do that. Or maybe it's just a shield that's protective. If we're altering work schedules and we're separating by 6 feet as administrative controls, we may not need to rely on PPE, but there might be times where we do. So I don't want to confuse the two. The idea was just saying, hey guys, we should always start with the best practices, the best controls first, which are engineering, administrative, and then last but not least, we should look at PPE type controls. But yes, you can use them simultaneously as well. All right, next question. Involving employees when developing plans to protect your business is the most effective. True or false? Excellent. And the answer is true, of course. We want to get, it's always most effective when we're involving our employees, asking for their input, and when we're ever looking at making any sort of changes, especially in the area of safety in the workplace, be able to accomplish the job task. Next up, we have true or false. Frequent updates and communications are a critical part of your COVID-19 control plan. Looks like it didn't launch. Let me try launching it again. There it goes. Very good, and that's true. We want to make sure that we're communicating frequently with all groups throughout with our preparedness and response plans. So back to the roadmap. We have discussed what is COVID-19, signs and symptoms, how to protect ourselves and others, risk to your business, what your business needs to do. We've discussed the best practices for exposure control plans. And next we're going to discuss resources and tools. All right, so there's a lot of resources out there, a lot of tools. The CDC, of course, is putting out a lot of information and recommendations for businesses. And at the end of this entire presentation, there's a list of resources with links, so you can go check it out. OSHA also has a lot of tools and resources. They did put out an employer's guide to help you develop these plans as well and talk about your responsibilities in this area in more details. And again, links here will be at the end. Some other tools and resources is reach out. If you're part of a business association or a professional association, reach out to them, okay? Or even if you're not a part of it, you can still find that information. Construction, there's AGC, the Associated Contractors and Builders, ABC. There's employer associations. For professional, there's a big one, American Society of Safety Professionals, which most of your safety professionals are members of. But even they're putting out a lot of free resources and information. These could be like toolbox talks, exposure control plans, all that stuff that we've been talking about today. Reach out to your insurance broker, get them involved. That's what they're there for. They help back you up. For those who also reach out to your loss control consultant, okay? Especially for our client partners who are in our group self-insured programs. You make contact with your assigned loss control consultant. That's what they're there for, to help you provide all the resources and figure all this stuff out, or to be able to just help you. Reach out to your company partners, right? Maybe even sometimes your competitors. I mean, we're all in this together, all right? Asking and sharing information. What are you doing? How are we doing it? All that stuff, all resources and tools. And there's tons of good free information that's being shared and passed around. Do just take into consideration, with it being, free, is to still kind of assess it and analyze it and make sure that it's good, relevant information, and that it makes sense, and that it is going to protect you and within compliance and all of those other things. We're also obviously a tool and a resource for you. Some other free stuff we've made for you available is we do have, we developed I didn't end the other poll, so you can't even see everything I was just showing you. So we do, is that poll off or is it still up? Can you guys see the poll? I can see it on my screen. Let me try it. There it is. It's ended. Okay. So if I do go back, you can see that list right there. All right, so reach out to them. There's another tool, free resource we did put together for you guys. We developed a self-assessment survey for you to go out and do. It's 10 questions. It's, like I said, a free assessment. This link will be, you can go click on it. At the end of it, it includes a custom downloadable report. So it'll have like your name, your company name, the date you completed it. It'll have a score. It'll also have your questions and what you answered, and then explanation, kind of like, who says that and why, as well as links to the resource of where it comes from, and recommendations. Okay. So if it's like, yeah, I don't have that, or I'm not doing that, there'll be a recommendation of what you could go do. And then at the end, there's like an action plan. So another free resource tool, it'll help you with documentation. That's out there. The other that we're also doing a lot of right now are virtual COVID-19 safety assessments. It's a little bit deeper dive than the self-assessment. So it's about a 1-hour Zoom meeting that we set up where we're going to review your current business operations. So we're going to say, okay, well, what is operating and how are you doing it, and, this, so on and so forth. Then we're going to discuss what your current plans are that you have in place. So if you do have a control plan, we'll review it and see if it's, makes sense on paper, and see if you haven't missed anything. It'll be a comprehensive assessment report will be provided, so way more in depth, way more thorough. It'll also, of course, include recommendations, links to their sources that says where, what, who, and where, and why you should do those things, any regulations, that kind of stuff. And it'll also, of course, include an action plan. The others that we're doing, which is a little more invasive, that we are doing a lot of right now, are on-site COVID-19 safety audits. This is an on-site audit. We're reviewing current business operations, reviewing the current plans that are in place. And this one is really that other step further. It's saying, okay, do I have a plan? Does my plan make sense? Does it cover all my bases? But the last thing that it's doing is it's verifying if it's actually being implemented, and is it effective? Okay, so that's the big difference on this one here. Of course, it still includes recommendations, action plan, all that stuff. So here's some takeaways. The takeaways are the risks to human health are high. Okay. And risks to your businesses are high if they're not managed and controlled. Okay. So I think that's a big realization to like think about, is to say, well, if we do nothing, the risks to our business are pretty high. But if we don't, or if we do something about it, and we put plans in place and we control this, actually we can reduce them really, 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 really low. We can reduce, so it's really, we can really manage our risk this way. Okay. We've talked a lot about it. We saw where we fall at in the risk categories for businesses, we're on the low end. So we just need to make plans, put them in place that are fairly easy to do. And if we do that, we're going to really reduce our business risk. Companies can manage risk can minimize risk to their employees and their business easily. That's what I just talked about. Develop a written COVID preparedness and response plan. Communicate frequently with all groups. Train all employees on the preparedness plan and response plans. Implement the plans. Conduct an internal audit. Conduct a third-party audit. Develop action plans for improvement. All of those. Of course, as I mentioned, this presentation will be given with you, so you can use it as a checklist if you want, kind of revisit it, and so on and so forth. Here's the last few little questions here we have is, are you interested in learning more about how you can protect your business and your employees? I'm going to kind of let that run for a little bit. I will say I'm not really sure what the answer to that question is. So for those of you who are saying yes, we'll just we'll follow up somehow and we'll talk about it. Say what more about it. It could just be more information. It could be more resources, or maybe it's a follow-on webinar, follow-on training. I don't know what it is, but we'll figure out what we need to look at and dive more into. But we did have a fairly high percentage, and hopefully we'll be able to put some more information out there for you and help you protect your business and your employees, of course. Last one we have is, are you interested in help and support in developing and or auditing any of your plans? All right. All right, so now I will leave it open for questions. I have a few I'm going to read off here, but if you have more questions, go ahead and pop it into the chat or the Q&A section, and I'll get to those here. So another question we had came in is, it was a recommendation. Thanks, Alex, for this one. This is a great point. He was recommending touchless thermometers or infrared thermometers. So with those, I mean, that's also the big supply and demand question is, what's available, what's not available. Are they, are you able to order it? If you have them on hand and they're good quality ones and you can trust them, absolutely. I think they're great options to be able to go do if you're looking at implementing that process. But if you do, again, I'd write it down. We need to think about it and come up with a good protocol and structure for all of that. The how we're going to do it, and then the later is the what we're going to do with it based on results. So if we get a desirable outcome, great. We already know that we're probably going to go to work. But what if we get a non-desirable outcome, and someone is outside the outlines that we set? What are we going to do? How are we going to do that? We need to write that down too and figure that out, especially when it gets into the whole HR side. But again, great recommendation. Another one came in is we have an employee who's been coughing since January. It's non-health related. Well, it's due to whether it's smoking or allergies, and can we ask them to go get screened to help alleviate some of the fears that maybe some of the other employees are having. Answer to that, I mean, I don't think you can make them go do it. And I think if you do get them screened, it may be difficult. I mean, if they can go get screened without potentially exposing themselves to getting it. I know that's the big concern right now too, is, you don't go get tested just to get tested, because you might end up exposing yourself. So really think that out. I think the best plan for that one would be is just communicating it with the rest of the employees, is to maybe have a toolbox talk or safety message about allergy season, about other health issues or signs and symptoms, and focus on the signs and symptoms of COVID-19 to help them be able to better differentiate the two, to say, oh, okay, yeah, he has been coughing since January. It hasn't changed. It hasn't gotten any worse. He doesn't have fever. Doesn't have this. And they kind of like take care of their own fears. That might be like the best recommendation. Maybe I'd probably take that as a baby step first. If that doesn't work, then maybe look at some next steps before just saying, hey, you can't come to work, or you can't come back to work till you get tested, and so on and so forth, unless you really have a major concern that they do have it. But if not, I'd look at some other options to help alleviate just the fears. Let's see, what other questions do we have? Well, question came in that said, should we allow truck drivers to enter the building to open their trailer doors, or should we require, or should we be required to open them? That's a really good question. And I think that, you're thinking along those entire lines of who are the groups that we interact with, and what are the sources, and then how do I control those sources? So, I think I would probably ask all of these truck drivers or vendors or contractors, and or groups of employees, if they're employees, to say, hey, this is your work area. So I'd say this is your truck, this is your baby, you keep it clean. And we want to make sure that it stays that way. So you as the truck driver, this is your baby. So, if you need to open the door to load it, then we'd like you to open it. And while you open it, we'll be over here. And you go open it, get the truck completely prepared and done. And then when you're done, then you let us know. And you go and stay in your area, in your bubble, and isolate or distance or whatever the case might be. And then we'll load it. And then when we're done loading it, we will let you close the door. And then that way, the only person closing the door would be that one person. I try to kind of break up and separate a lot of those groups as much as you can and control that. Now, if it's not possible to do that, then we might, look at some other different control options. But great question. Okay. Well, I don't see any other questions that have come in. Hopefully I answered all of your questions. As I did mention, we do have our webinar calendar. It's on our website. This isn't something this is actually, so we do this monthly. They're free webinars for our clients and for anybody out there that businesses who want to participate. So they're on our website. We list them. There's a schedule out there. Also, all of the previous ones that were done, they're all on demand. So you could go back and watch, the past year's worth of all kinds of other really great topics. So today's was supposed to be a different topic, but we replaced it based on request and obviously the situation. But right now, this may change, but our next is May's. We could have one in between now if it's by special request again, but the next planned one is May 13th. It's our part 2 for safety culture perception survey. I will say that I think that we might do that, but it might get pushed back again or swapped out for another topic. Or maybe we just end up doing it anyways and adding in a different topic based on the current situation and the demands. We'll see. But June, we always have vote now. You'll get a questionnaire after this too. We're always interested in, not us sitting over here saying, oh, this is what you want to hear. No, we want to be able to provide you what you want to hear and what you want to know. So your feedback and participation is extremely part of the success to us being able to provide you the best information. So if you have any other information or got any questions, here's our contact information. You'll have that. But if nothing else, thank you for your time. Thank you for everything you're doing for safety and for helping your companies and businesses and your employees stay safe and healthy during this craziness. Here's the list of references. If you have anything you want to share stuff with me or with everyone else on the call, please feel free to send that in to me and we'll get that out to you. But again, stay safe, healthy, and thank you again for your time.